Hi everyone. Okay, the session today is about EU-JAMRAI success stories. Today we have Markela. She's a microbiologist from Cyprus Health Ministry. We have Michael, that is the work package leader on behavioral change, if I'm not mistaken. And Selma, who is the JAMRAI project leader for Croatia. Yeah, thank you very much. We haven't rehearsed much, so bear with me. We'll try to be as professional as we can, not as much as the colleagues from the work package from communication, that's for sure. But we will try our best. Before we exchange and we discuss about the success stories, let me say just a few words from us, from the Commission. First of all, it's a privilege to be here today. Thank you very much. It's thrilling. I mean, we have seen these days, these 2 days, the amazing work all work package do. Absolutely astonishing. I was talking to colleagues from the Commission, and we are speechless. I mean, it's really, really, really good work. So congratulations, first of all. And these days, these 2 days, we have been hearing about the results from these work packages, and we've been hearing also about the Council recommendation and also the One Health approach, that is our architecture, let's say. But before we start engaging, I would like to say a few words or a message from the Commission, which will encapsulate a little bit what we've been saying, what work package leaders have been saying in the last few days. These first 2 years have been an important stage, having the strategic phase of the joint action. We've done a lot of work together, the Commission and the consortium. We have together, here I need my notes, sorry. Together we have provided the structure, we have generated the evidence in this strategic phase, roadmaps, guidances have been developed. The Commission has provided this strong political framework, which is the Council recommendation. And I mean, very importantly, we have also provided the political support for this incredible joint action. That's not difficult when you have such a great bunch of professionals together. But today we are at the halfway point of this joint action. And this strategic phase is over. We've done our work. The Commission, the work package leaders have done and produced all these tools. And now it's up to you, colleagues. It's up to participating countries and partners to enter the next stage. I think that many people here have been referring to these 2 words, implementation and ownership. I echo the words from Lucy yesterday, talking about ownership, from Marie-Cécile about implementation, but this has been recurrent these 2 days. And this is crucial. I mean, it's very good that we have all these tools, but we have to put them in use. We have to really implement these tools, and we have a budget that we have to spend, and we encourage you to do your best. And why? For 2 reasons. One of them is obviously because of the joint action has to be successful, and today we will discuss about the successes of the joint action. But also because we need this in Brussels. We need your success for political justification. I think that over the last few months I've been talking about this frequently. We are in Brussels in this multi-annual financial framework, which is where we are going to develop the budget from 2028 onwards. And we want to be ambitious. We want to keep up with this fight. We want this joint action to have a new version. We are in the second JAMRAI, but we envisage more. We think that the potentiality is clear, is there. It will be a pity to stop it. But we can do so much, and to do that, we need your support. And for that, again, implementation and ownership, owning these tools is essential. The more you do, the easier it will be for us to justify this need to prolong JAMRAI with our hierarchy. I mean, it's not a given. I don't want to give false hopes. These negotiations are difficult, but the better the justification, the higher the chances. So there you are. I leave it there. Then I want to acknowledge the liaison officers, this figure that has been created by Work Package 5, by the consortium. These are key actors in the implementation stage. And we acknowledge that it's not easy for some of them. These liaison officers are the bridge between the joint action and the national administrations, and sometimes some of them are not fully recognized, or they're in a difficult position, and we will try to work to reinforce this figure. That's quite important for us. And also, there are 30 participating countries and 128 partners. And there are a few leaders that are outstanding, but we have to be all on board. And that's also one of the messages I wanted to give. It's a work that is only complete if everybody participates in it. So please, implementation, ownership, and full participation from everybody. And before we start talking about the success story, sorry, I'm taking a bit long, I would like to share with you a personal anecdote. My background is a veterinarian. I was a clinical vet for a few years. And some of you know that, however, for the last 15 years, I've been working more in EU fisheries policy. So my life has been about the fisheries gear, fisheries quotas, tuna, cod. So about a year ago, I decided to transition to do something different. And being a vet, it made sense, this opportunity. But you can imagine that the transition from fish to AMR is not always evident. And I get this recurrent question, this question from colleagues, especially in Mare. It's like, okay, so how is the change? They laugh a little bit, how do you feel? And I always say the same thing. You know, I'm super happy, and one of the reasons I'm very happy is because I'm part of this incredible joint action that has an impact in society. And this is very true, because sometimes we lose perspective. I mean, I think that the probably worthiest and most important thing we have, the best objective we have in JAMRAI is that we are going to save lives. And this is the reality. This is the core issue. I mean, the value of our work will be valued by every antibiotic we preserve, every infection we prevent, and this will eventually save lives. So this is it. This is the core business, and this is magnificent. This is an incredible task. So without further ado, because I'm taking longer than I thought, and I have this timer that you don't see, but it's, it's scary. I was concerned that I wasn't going to fill out all the time, and I think that I can be talking for 20 minutes. But I don't know, I promise. But okay, we have positive news. Implementation, but this is already happening. And it's already happening, and this is why we talked to some member states, or to all member states, actually Madrid in October, and we threw this idea, like, okay, why don't you give us some success stories that we can already use in this political scenario that we are negotiating the budget. And the response was incredible. I mean, we had around like 20 countries replying, 23 success stories. We have printed some fact sheets that we have disseminated in social media. You can find them also in the info point. The impact has been quite positive. We also have them in our website. And I mean, these success stories, some of them are great, but we have selected 3. But before I start with these 3 success stories, I think it's important to recognize one particular success story that happened very recently. And I think that Drago probably is around here, is Bulgaria. they have managed to adopt their national action plan, which is, we know how difficult it has been for Bulgaria. This is an incredible success story, one on top of the 3 we have today. And I will start without further ado with Selma, Croatia. These success stories, I will explain them a little bit, and then I will ask some questions. But Selma, you proposed us this super interesting success story. Is about awareness. Has been supported by Work Package 10, our magicians from the communication team. And it's about doing a puppet show for children and also some workshops for the elderly. It's awareness about hygiene and prevention. And you have also involved the public libraries from Croatia. And the first question is an obvious question, is why you have chosen such diverse age groups, and also the role of the libraries, because when we were discussing to prepare this panel, there was an interesting element about this. That if you can share with us and the audience, that would be great.
Thank you, Ivan. The Croatia is recognized as a success story. And our rationale for choosing these 2 population groups as a priority for raising awareness was multi-layered. And first and foremost, we have chosen these 2 groups because they are very susceptible to infection diseases. Therefore, by preventing infections and antibiotic consumption, which is most prevalent in these 2 groups, could be decreased, and as a result, antimicrobial resistance can be prevented. Also, our overall aim, our program, was to strengthen hand hygiene and good practices and infection prevention behaviors in both target groups. And our specific objectives were to hand hygiene, respiratory hygiene, and the importance of vaccination. Why we chose the library? Because in Croatia, a network of cities libraries, public libraries, is wide and strong, and it is the meeting point for every ages. And we organized educational sessions with cooperated with kindergartens and schools, and also we organized the educational sessions for elderly people, because the elderly people, their library are the meeting point for them. It's very big impact for social activities in communities.
Thank you very much, Selma. Now, let's talk about Cyprus, Markela. And the Cyprus success story is a very interesting one. It's very different. Croatia is awareness. Cyprus is AMS. You did an AMS masterclass. You chose the 8 biggest hospitals in Cyprus for private and for public. And you collaborated with, you did it through the Drive AMS program with funding from JAMRAI, but also there was collaboration from, or strong collaboration from the health services of the Cyprus Ministry of Health, also from university hospitals from the Netherlands and Greece. The end result, this was a masterclass, but also a training. There were 38 professionals from these hospitals, and the final goal was to develop these AMS project plans. Was very successful. And the question for you, Markela, the first question, hopefully if this ticking bomb that is making me nervous will give us time for more questions. The first question is that there's a strong collaboration between these three countries, Greece, the Netherlands, and Cyprus, of course, and together with 8 hospitals. And the question is how this combination of EU support and international expertise help tailor the trainings of these AMS masterclass.
Thank you, and thank you for the invitation to share our success story in this very, very important meeting. So, as you said, the masterclass was organized in a very successful cooperation between the Medical and Public Health Services of the Cyprus Ministry of Health, the Radboud University Medical Center, and the the University of Thessaloniki in Greece. And the faculty for the masterclass included experts in antimicrobial stewardship and implementation science from the Netherlands, from Belgium, from Greece, and from Cyprus. Obviously, the participations of experts from the Netherlands, from the Radboud University Medical Center, was crucial, as this is where the Drive AMS masterclass was initially developed. But most of the teaching was delivered by our colleagues from Thessaloniki, from the Greek team. And I think this was crucial for tailoring this specific masterclass to the needs of the Cypriot hospitals that participated for 2 main reasons. First of all, this allowed the use of the Greek language during the course, but most importantly, Cyprus and Greece share similar antimicrobial resistance epidemiology. They share a similar antimicrobial stewardship state. And of course, our 2 countries have common cultural determinants that influence antimicrobial use. And finally, of course, the faculty also included health professionals from Cyprus, which further facilitated delivering a course that was adapted to the needs of the participating hospitals. As you said, there were 8 hospitals participating. The hospitals were selected by the Cyprus Ministry of Health team. We chose 8 from the state sector and 4, they wouldn't add up, and 4 from a private sector. And we chose not the 8 biggest in the country, but the 4 biggest from each sector. And we believe that there was a successful choice for maximum impact. Everybody was very enthusiastic and accepted the invitation to participate immediately. 38 participants in total, 3 to 5 from each hospital, multidisciplinary clinicians, clinical microbiologists, pharmacists, nurses. And we received excellent feedback from the participants that this was what they needed, this was very useful, and that this will affect and influence their future practice.
Thank you very much, Markela. Beautifully explained. And now it's time for Malta. Michael, thank you very much for being here. The Maltese success story is again different. I mean, it's not AMS, it's not awareness, it's One Health surveillance. And we chose this one because we thought it was a very interesting and different success story. I have explained in my introduction that this One Health is the architecture under which we are working nowadays. And this is a perfect example. This was supported by Work Package 8.4, I think, if I'm not mistaken. And it was a One Health surveillance workshop on antimicrobial consumption and antimicrobial resistance. There were 11 participants, and it's the first time that professionals from the 3 fields meet together. There were a number of conclusions, recommendations, but the first question is, I'm curious about, is about this, I mean, putting together in the same place for a few hours professionals that have never been together before in a space, and what was would you say, the main consensus they reached between these 11 participants from these 3 very different fields?
Thanks, Iván. Thank you for the invitation. So, as you said, this was the initiative in relation to what was described yesterday in terms of surveillance, use of the EpiCap tool to map surveillance.
Sorry, I forgot to mention is the EpiCap tool that I think that was Moria Kelly that explained yesterday. So sorry, that's true.
So basically, you know, we took this opportunity to get together the different actors. Now, this is the smallest country in the Mediterranean. It's literally a rock in the middle of the sea. But like many other instances, you know, communication very often is a challenge. It's a challenge even more because historically, you know, the emphasis has always been on the human health surveillance, where we've been relatively strong. But as a result, the other sectors of the One Health sort of lagged somewhere behind. So this was a great opportunity for us to actually get the people together. And as you said, you know, do this mapping exercise, which was extremely useful. But above all, come up with some consensus approaches. And I think the first consensus was, listen, this cannot be a one-off, it has to be sustained. And as a result, following that initiative, we have now set up a working group within the National Intersectorial Coordinating Mechanism, our National AMR Committee, which has a statutory legal status, and therefore this will hopefully move this forward. The second consensus was that we need to identify what our British colleagues call the low-hanging fruit, you know, things that we can do without major political support requirements. So one of the things we've agreed is that we'll actually set up an informal, you know, WhatsApp network where we can communicate with each other very quickly should there be any events or incidents that affect more than one area of the One Health program. And the other thing is that, again, you know, we realize that things are being done. Maybe we can do more, but there's already a good repository. So again, working through the committee, we're working so that hopefully within the coming months, we will have a part of the website of the committee that will have all these surveillance data available publicly for anyone to view, again, as a One Health approach.
Thank you very much, Michael. Very interesting. I mean, I think that there is a lesson to be learned from the small island in the heart of the Mediterranean for all of us. It was an incredible success story that we wanted to share, and thank you very much. In that, okay, the ticking bomb has given me more time. Okay, I was sweating. It's like, this is related with the black button, or I don't know. Okay, so we have some time. So, Selma, let's go back to the puppet show and the workshop for the elderly in this setting. It's very interesting with the libraries. But there is another component that is also very interesting about the success story of Croatia. There is a transnational component. And this is JAMRAI also. We know that you were invited by Slovenian colleagues, I don't know if they are here, to their JAMRAI National Day in November, 24th, 25th of November. And we would like to know, the question is about how you think that JAMRAI facilitated this transnational contact, and how did the presentation in the JAMRAI National Day went?
Yes, first I want to mention something, that our children's book are available on website, ECDCF website, and can be shared and used.
Okay, perfect. I'm
English,
sure that we can put this in JAMRAI website,
yes.
For dissemination maybe?
Yes.
Or package it, Laura. Stop texting, listen.
And
I'm kidding.
Yes, last year, Slovenian colleagues invited us to their national JAMRAI annual meeting to share our activities. And we had a very good and enthusiastic feedback from them, and we are really open for further cross-country experience sharing activities, and we hope that we share our experience and Slovenian colleagues in enrichment of their raising awareness activities. And also we plan to invite our Slovenian colleagues this year for our Awareness Week, Antibiotics Awareness Week, to share their experience in other fields, EU-JAMRAI, example, stewardship, antibiotic stewardship.
Fantastic, thank you very much.
And thank you. We are very pleased that EU-JAMRAI has strengthened our connections with our neighbors.
I think that this is one of the... Thank you, Selma, and thank you for those words, because I think that we are all here clearly thanks to JAMRAI. So, I mean, it's this beautiful network that is connecting people, and we have very positive impacts and tangible results. So, thank you very much. Now, the next question is Markela. Again, this AMS masterclass. Reading your success story, there's something that was very interesting about the trainers, and is this idea that change takes time, and the trainers in the AMS masterclass gave this example of the bamboo. The bamboo is a small plant that you water and water and water and nothing happens, and all of a sudden it grows. And it's this metaphor that I think that the trainers wanted to use for the AMS, that you also started small, and the question goes there, but let me explain. You started with small examples and with trying to make plans of something that it was not too ambitious. And the question is whether you can give us a concrete example of one of these small actions that was developed and then implemented, but as a result of the AMS masterclass.
So let's first explain that about the projects that the participating hospitals had the opportunity to develop during the course, which were based on small goals to begin with. So during the course, essentially the participants were taught about and guided through a step-by-step approach to developing an improvement intervention in their own hospital setting. And this approach consisted of defining a specific antibiotic use problem, measuring antibiotic use in relation to that problem, then analyzing the different barriers and facilitators to improving practice, designing an improvement strategy to address this, and finally developing and implementing the intervention. And of course, at the end, remeasuring antibiotic use to see if the intervention has had any effect. So during the course, each hospital had to develop a specific project plan. They had to present their project plan to the whole group, and they received feedback from the faculty. And as you have said, we don't start big. We are encouraged to have small, realistic goals to, I think it's been mentioned before, to go for the low-hanging fruit. So specific examples of the projects that the different hospitals selected included things like de-escalations to amoxicillin in pediatric inpatients admitted with community UTIs caused by amoxicillin-sensitive E. coli, review of meropenem, 72 hours post-prescription in inpatients at the respiratory ward, and there were a few projects that concerned the implementation of guidelines regarding surgical antibiotic prophylaxis. And it is very important to say, and it was a very good characteristic of the course, that the progress of each project, of each hospital project, is being followed up in webinars up to 12 months after the course. So we are now going to have our last sort of a year after the course webinar in February to see the progress that each hospital has managed to make regarding their own specific project designed for their own setting. But yes, I do like the example of the bamboo. it's an example that's worth giving to like politicians or other people that are eager to seek change. Change takes time, it takes a lot of effort, but you have to be persistent and patient in order to see results. So thank you.
Thank you very much, Markela. I think that we are having loads of very interesting reflections and things that we can use for all of us. These success stories are something to be shared and learn from. And the final question, and then hopefully we will have a few minutes to open the floor to the audience for more questions. The last question is to you, Michael, on this One Health surveillance network, workshop. We've talked about the professionals, but the last question of the panel is about JAMRAI, and how do you think JAMRAI as a joint action and as this network has helped to develop this workshop?
Yeah, so I think there are two elements here. First of all, the availability of the tool. You know, so the fact that you don't have to reinvent the wheel, that you have a validated tool that you can use is really important. Secondly, well, I would say three actually. So that's the first thing. The second thing is, and it makes a difference, you know, when you say, listen, this is coming from the Commission or this is coming from the EU, in some countries, not all, but in some countries that has probably more weight than in others. So the fact that this was coming from the outside, you know, they say, I mean, a prophet is never accepted in his own country. So anything that comes from outside is very often looked at quite more positively. So the fact that we had this tool available, that was coming from an EU project, and the fact that the project was actually providing the finances for this. You know, now it didn't cost hundreds of thousands to organize this workshop, but you know, it is still a struggle to get even a small amount of funding in some countries. That is the reality. The reality is, and it's not just Malta. You know, I'm privileged, Diamantis is here, you know, I've been with Diamantis for numerous country visits, ECDC country visits, and we see it. You know, even minimal funding is not there. So the fact that there was funding both for the personnel, you know, to coordinate, and it took a lot of work to do this, you know, hundreds of hours, plus to organize the thing, you know, to have a meeting, to have the venue, to have lunch. That was a really important greasing of this process.
Thank you very much. I think that we have 3 minutes left in this ticking bomb. I would like to open because I mean, I would like to keep talking to you, but I think that I don't know what are the consequences of that. So we're on the safe side if we open the floor for some questions from the audience. We have a few minutes, so if any of you have any questions for the panelists that probably have more interesting things to say than me, please do so. Marie-Cécile, thank you.
Yes. Yeah. It's quite the end of the 2 days. So, yes, I have one comment and one question, if I may. One comment is what you say about that EU-JAMRAI allowed the connection with your neighbors, the neighbor countries, and I'm very happy to hear that, because it's really also the spirit of EU-JAMRAI too, to make connection within the neighbors, and particularly in these troubled times we have all over the world. I think reminding that Europe is a country of neighbors, is an area of neighbors. Yes, it's very important, and we have also neighbors outside the European Union in the EU-JAMRAI too, as we have other countries, and we have also colleagues from Ukraine, and we are very happy. So I think it's very important, and you know, where I am living in France, there is once a year a dinner of the neighbors. You probably have that also in your countries, and maybe we can say that this General Assembly, once a year, it's the dinner of the neighbors, and I think it's a good image. And my question is for you, all three, with your experience, with your success story, have you planned to evaluate your actions with, I don't know, indicators you can have, for example, for AMS? Have you seen already results, positive results for the outcome of what you have put in place? Thank you.
Okay.
Markela,
so in terms of the AMS, I think at the moment, I think it's very early to see actual results in terms of national indicators. So at the moment, what we can see is that for the first time, we have this new, and I have to explain that this was an excellent time for this course to be organized in Cyprus, because antimicrobial stewardship is very, very primitive in our country. In that, until recently, until a year ago, we did not have antimicrobial stewardship teams in hospitals. So just before February, the Ministry of Health decided that it was time really for antimicrobial stewardship teams to develop in Cypriot hospitals, and did make the establishment of AMS teams in hospitals mandatory. So we have limited sort of trained professionals, limited expertise. So this course was an excellent opportunity, and when it was offered to us, we were really excited about it, because it was an excellent opportunity to train people that were not involved in antimicrobial stewardship before. So in terms of seeing results, in terms of consumption or national indicators, we think it's very, very early, so we're at the very, very early starts, but it's very, very encouraging to see people starting taking actions, starting thinking about it, and the team starting to operate. So although it's very early to report, in numbers, decreases in anything really, the fact that we're doing something, hopefully we will get to the babu eventually.
And yeah, change takes time, right? So let's be patient, because it will happen. Well, Michael or Selma, do you have any things to say about the indicators or follow-ups?
Yes, I need to share my wish that I hope for continuous and possible extension of JAMRAI.
This is the right place to say it. Okay, thank you. We hear you. Michael,
No, I think yes.
you're asking me for money now?
No. Well, if you have, we don't say no, Malta never refuses anything that comes with. So, no, but I think, it's basically what I said before. So the fact that we now have this established network is, I think, already a good outcome. This networking between us is also very useful. And hopefully, the cherry on the cake will be that repository that we will hopefully be setting up over the next few months with all the surveillance data available publicly for anyone who would like to access it.
Okay, so thank you very much. Unless there are any more questions, I will... No? Okay, so again, please, ownership and implementation, drill this in your brain and daily habits. We have 2 years of work, you and also us, to guarantee the continuation, guarantee the funding, but we cannot do it without you. So please work hard, spend money on the budget,
get results,
and implement all the magnificent tools that have been developed these last 2 years. Thank you very much.
Thank you.